Doctors at Great Ormond Street Hospital began a revolutionary new treatment this morning to try to save the life of a baby girl. They're optimistic that gene transplant therapy will cure Carly Todd, who suffers from an immune deficiency disease. It's hoped that such advances in gene replacement will pave the way for the treatment of other genetic disorders. Our science correspondent James Wilkinson reports.
8-month-old Carly Todd began her pioneering treatment this morning. She suffers from an enzyme deficiency disease caused by a defect in one of her genes. As a result, she can't fight infection. The doctors here at the Great Ormond Street Hospital for Children in London hope to repair the defect. The go-ahead for the gene therapy experiment, the first of its kind, was given recently by the government-appointed committee under Sir Cecil Clothier, which looks at the ethics of gene therapy experiments. Doctors will first remove some bone marrow from Carly Todd's pelvis. It will then be flown to Holland, where scientists will use a virus for the gene transfer. The virus carries the healthy gene. When it infects the bone marrow cells, the gene will become incorporated into the cell's own genetic structure. The cells will then be returned to Carly by injection. The doctors treating Carly believe there is a good chance of success.
There is a very good chance that it will work, but there must be reservations about how effective the treatment will be because it's such unknown territory.
The treated bone marrow will be injected back into Carly Todd on Monday. Doctors will then keep a close eye on her over the next few months to monitor both the safety of the technique and to watch for early signs that her immunity is being strengthened. Patients with cystic fibrosis who need regular physiotherapy may also benefit from gene therapy one day. Today, scientists announced they have successfully used gene therapy to treat mice with the same lung defect. Doctors are now planning a clinical trial in patients. The gene wouldn't be delivered as part of a virus. Instead, the genes would be wrapped in a layer of fat and delivered by aerosol. Here again, the scientists are optimistic the technique should alleviate the symptoms of what is the commonest severe genetic disorder in Britain.